Good morning, everyone. As a member of the World Community Service Committee, we do humanitarian activities and projects around the world. One of the programs that we do is funding a Rotary Travel Scholarship for the Center of Global Health at University of Colorado. This is a scholarship program we do in conjunction with at least 3 other, if not 4 or 5 more Rotary clubs in the area. These are internships available to students at the School of Medicine, Dentistry, Pharmacy, Nursing, not veterinarian. But it's an opportunity for them to travel internationally and work on a project over the course of the summer. So I'd like to introduce you to Jane Park, who is a second-year student at the School of Medicine, who's going to talk to you about her project in India last summer.
Hi, thank you for having me here. So this summer I traveled to India as a part of the KCCI program, which is an internship set up by UNICEF in collaboration with the government of India and the Ministry of Women and Child Development. And so what they do is they choose students from multiple disciplines from around the world, and they place them in teams in the different states in India. And so this was my team, and we were sent to Bihar to evaluate the polio program there. So as Rotary is well familiar with, the incidence of polio has dramatically gone down since the polio eradication initiative in '88. And so the figures have gone from more than 350,000 cases of polio in 1980 to 1,655 last year in 2008. And so that's greater than 99% decrease in polio cases. And so there are only 4 countries where polio is still endemic, and those are Afghanistan, Pakistan, Nigeria, and India. And in India, there's only 2 states where polio is still endemic, and that is Uttar Pradesh and Bihar, where I was. And so you can see the arrow pointing to the northern state of Bihar. And in Bihar, they have this innovative program where they went from using purely volunteers to incorporating government grassroots workers. And these are all women who are in the communities already working with women and children. And these women, they've brought them in as vaccinators and as mobilizers. And some of the benefits of incorporating these women are that they are already in the communities, so they're familiar with the women and children there. They have the trust of the communities, and their roles already involve work with newborns and immunization, and so it was easy to piggyback polio onto their tasks. So our team, what we did was we researched 3 main questions. What is the role of the Anganwadi worker? What are different capacity development strategies that are in place? And also, how have these been effective? Not both, but at the levels of the community, Anganwadi workers, and the government. And so what we did was UNICEF chose a district for us to go, which was called Khagaria, which is located, you can see it in blue. Oops. Sorry. And in that state, we went to 2 villages, or 2 blocks, and they were Gogri and Aloli. And these communities were representative of some of the polio problems. So there's low literacy and high levels of migration. There's also flooding in the area that prevents children from being immunized. And so we went and, what we did was do qualitative and quantitative interviews. So we interviewed 80 mothers of children under 5. We interviewed 8 women who were Anganwadi workers, and we also interviewed government officials. And some of the limitations of our study were, of course, it was a small sample, so 80 mothers out of the 20 million children who are vaccinated each month is a very small sample, and we had a small amount of time to do our study. But we tried to make it as objective as possible. And what we found were that the women we interviewed were, so as you can see, about 96% of women did not have a 5th grade education. In the 2 blocks that we went to, Hindu was predominant in Aloli, and then Muslim in Gogri. And also, as you can see, the socioeconomic indicators show that it's poorly developed in terms of access to toilet facility. Most people practice open defecation, excuse me, as you're eating. And there was more access to tap water than before, but still what you saw was a lack of access.